the public sector, the innovators, investors, and entrepreneurs. So that's the role that we play. We've been working mostly on health, and what we have realized over the years is that if you want to expand and accelerate access to healthcare, as you know, 1 out of 2 people don't have access to essential healthcare. So, what we really believe is that unless we look at innovations, unless we look at technologies, and unless we look at bringing the different worlds together, we will not be able to achieve success. So, I won't go into any of the details. You're the experts on climate and health. I won't go into the details. But what struck me is that the country that come from, in the capital, a newborn baby, day one, when you look at the lungs, it's like someone who smoked 15 cigarettes. 15 cigarettes. That is the horrifying data. That's the world that we are giving to the generation that's coming after us. But can this be addressed? Can we really start looking at bringing in innovations that can address the climate? Because if you look at the impact on health, it's huge. 1 out of 4 deaths is related to climate issues. So there is a need for us to address that. And we believe that that is possible. But unfortunately, we all work in our own silos. The health world has its own conversation. The climate world has its own conversation. How do we bring these together? Because without coming together, we will not be able to bring about impact. We did a lot of work speaking to the health experts at the World Health Assembly, which thanks to DG Mathur, Dr. Mathur, we organized conversations around the World Health Assembly in Geneva this year, and then subsequently at the UN General Assembly. We spoke with several ministers of health, several experts on health. Everybody believes and understands that there is need for the two worlds to come together, because we are seeing, I mean, as a health minister, you see the day-to-day impact of climate in your work. But when we ask them, what can you do specifically? And this applies also to some of the international organizations working on health. The specificities are lacking. So that is where we started bringing together and convening the different worlds together to see what can we do, how do we break these silos, how do we address the ignorance of the practical what needs to be done. There are several people in this room who have demonstrated what we can do, and I'm sure we will hear from people like Harish and others who are in this room. For me, the partnership with the International Solar Alliance is absolutely critical, because what we see is that today, if you, as I said, 1 out of 2 people don't have access to essential healthcare. So if you want to accelerate that, digital health becomes very critical. And if you want digital health, you need to have access to electricity, because without that, you can't do any of these long distance work. We have done several countries where we have seen the immediate transformation of access to healthcare by just bringing in the energy. So very, very grateful to you, sir, for your support and for really leading the charge on accelerating access to healthcare through your work on addressing both the twin benefits of climate as well as healthcare. And it was wonderful to hear you explain to one of the experts outside, saying, look at vaccination. If we had electricity, we wouldn't have had the same trouble, which is so true. And it is really that enlightened conversation that needs to happen. So we believe that this is important. Number 2, innovation. We are seeing so many innovations emerge. What we are not seeing is the scaling of these innovations. And we believe that energy becomes a fundamental enabler for that acceleration of innovation, which is absolutely critical. And the third piece, which we find in the worlds of climate and health, I am a great believer that if you look at the healthcare movement, for the first time, we brought about the whole concept of people-centered, rights-based approach to healthcare. That's what we have seen in global health over the last 20, 25 years. Yet, we have not been able to crack the equity aspect. In the whole climate conversation, I was walking down with one of the ministers, and he said, it is great for you to talk about climate. That's all happening in Dubai or New York or Paris or anywhere. How does it matter for the person who is in the last mile? they are the ones who are paying the biggest price for this. How are you going to address that? How are you going to engage them? And that is where, for us, we really believe that we have an opportunity as part of the engagement on climate and health. We can frame it around the whole issue of access, about equity, and looking at the bottom of the pyramid, as Jagjit was speaking with us earlier. So the whole concept of the Climate and Health Innovation and Equity Fund is a fund that we are launching, which is going to be bringing all these aspects together, working with countries, with the public sector, working with the private sector, working with the entrepreneurship community to really support that last mile access to health and address the climate challenges, to adapt and to engage. And that is where we are very, very proud to have this group coming together and to start this. I know there are several others who are joining us during the course of this session, and we'll hear a little bit more about each of these aspects of climate, health, innovation, and equity, and the financing that goes with it. Having said that, we'll come back and say a little bit more about the fund itself in a moment, but I would like to, it's such a privilege to have you, Dr. Mathur. Thank you very much for being the kind of champion within the energy and climate sector to speak to health and promote health. Would love to hear from you, sir. Thank you.
Thank you very much, Pradeep. And it's just afternoon now, and a very good afternoon to all of you. Pradeep, many years ago, and Harish remembered this. I was very surprised that he did. But many years ago, and what is it now, 20 years ago? 20 plus years ago, Harish had introduced me, in passing, I mean, there are thousands of people he meets, to a dental chair powered by solar. That got me thinking that now we could provide dental services in places where there was no electricity to run all the equipment which was there on the chair. But you see, at that point of time, I think the reason why we discussed this was the amount of energy efficiency he had brought into the chair as well. So therefore, the amount of energy needed was much lower. The years 2020 and 2021 taught us something very different. It taught us, amongst other things, that if we had reliable coolth in all our primary and secondary health centers, we could have a stored vaccine at levels which we did not have. I personally believe that a lot of people lost their lives. What has also happened is that, therefore, both in the medical bureaucracy as well as ministers of health have started understanding the need for energy. But Pradeep, one of the things why I was so anxious to meet health ministers is that I see that health and energy are seen as two silos in governments. And this is in governments across the world. I think we need to break these silos. Ramesh will talk to you about the various health solarization initiatives that we have taken. What we feel is that through the energy ministries, we start creating a potential for them to see the opportunities that occur in the health sector. And I'll be brutally frank with you. One of the challenges that we face is how on earth do the solar facilities that are set up, either they pay for themselves or how are they maintained? Because as Harish's work, particularly in the northeastern states of India, has shown, you can change the system. You can work towards the creation of solar facilities, and the governments of those states paying the larger part, I think in some states as high as 70%, to set up the solar facilities. To me, the challenge also is one of maintenance. Because too often in the last 30 years or so, we have seen that white elephants have been set up by putting up solar facilities in places where no maintenance was provided. It means, therefore, that the best is, can we get the health departments to pay for the electricity bills for electricity that is supplied to them from solar? Can we? I don't know. But this is a conversation. It will be great if we can help occur between the ministries of health and the ministries of energy. The second is, one of the things as we went ahead with this, Harish's work in northeastern Indian states energized us. As we talked, we realized, the private sector said, alone, these are very small opportunities. It does not make sense for us to invest. So they are therefore looking at larger, not very much larger. They're talking of a few 100 kilowatt at least. They're talking of 1 or 2 megawatts at least. That's the range. This means solar mini grids, solar and batteries, which have a local distribution around them, including to the health center. Then we could help. Today, typically the solar towers of the cell phone systems are the basis for providing the anchor load to the solar mini grids. Can the health centers become the anchors? That will be great. Because one, the number of health centers, when you add it to the number of cell phone towers, increases it by a factor of 2. So the number of health centers is at least, number of primary health centers is at least double the number of cell phone towers that there are in remote areas. In urban areas, it's slightly different, but in remote areas, that's. Which implies that the second thing we need to talk to the ministries of energy and health is whether they can coordinate, and the health ministry at least assures us of a budget to these secondary health centers to pay for electricity. I think there will be different models in different countries. There may even be different models in different parts of the same country. But starting this conversation is important. Also, in many countries, the health is, while there be Ministry for Health, the actual health implementation is done by a health bureaucracy. It's the health bureaucracy who will do it. The health minister may provide instructions or not oppose it or strongly support it. Similarly, on the energy side, there could either be a regulator or it could be private sector initiatives as we start. The short point I'm leaving you with is that we have very specific tasks. We have shown that solar technologies work for health. We have shown that the acceleration can occur. In other words, there are technical models which work. I think the challenge now is to see how we can help create a system that is profitable for people. And by profitable, I just don't mean to the private sector, I mean profitable also to the users, to see how we can help provide energy that can greatly expand the range of services that are provided. Pradeep, many, many thanks for partnering with us in this work, not only today, but also in the days past. Many, many thanks.
Thank you very much, Dr. Mathur. I believe that many of the areas that you highlighted, the whole fundamental issue of ownership, who owns it, why is that seen as fundamental to your development, to your health, and the economic opportunity behind it is something that we need to crack. There are some good examples. We'll hopefully bring in some of those. And also maybe there is the need for bundling, not just providing energy, but also like what you said, dental chair, which is solar powered, maybe water that can be generated. So we need to create that economic kind of models, and that's something which we're working with some countries now, and would love to see how we can take that forward. You spoke about some of the specific experiences in countries where ISA is already supported, and maybe that's where Ramesh, if I could ask you, Ramesh Kumar Kurupat, many of you know him. He's the chief of the PPIC unit. Thank you very much for being with us and sharing.
Projects implementation. This is where the meat of activities occurs.
Okay, so the program, project, and it is really about the translation on the ground, the implementation. Ramesh.
Ramesh, do you have slides?
We'll have a video. Okay. Yeah. To start with, many thanks to Pradeep, and Honorable DG has already talked about giving an overall view what ISA is doing. And what we will do, because we thought we implement some projects in the countries that will give a sense of what we are going to do. That was our approach. Thanks to even Jagjit, he was part of us, and when we planned it, and the fruits are now yielding. So I will also extend our credit to Jagjit for being there. So before talking anything about what we did, we thought we will run a video so that what we have done. And in fact, after that, I would like to talk more on that, because after a conversation between DG and Mr. Harish yesterday has given a lot of thought-evoking processes which we need to take it forward for the other countries, because the on ground what is happening is very important. Of course, our vision is important. Equally important is what is happening in the ground. So both the things we will take it forward. So I will, before talking much on that, I will request my friend Rajendra to run the video now. Thank you.
The International Solar Alliance has initiated a number of demonstration projects with our member countries who are LDCs, least developed countries, or SIDS, small island developing states. The goal of these projects is to show the many faceted benefits that occur and therefore create an environment within which upscaling can occur. As a result, these demonstration projects focus on, number one, practicability, that they are doable, on local relevance, that they provide here and now benefits to people, employment opportunities, because each solar project, whether it is the application or the supply of solar materials, needs people who can put them together and install them and maintain them. All of these lead to a huge number of benefits. They lead to benefits in terms of enhancing agricultural productivity, because either the water is now provided by solar rather than diesel, or in solar health facilities where the benefits are provided that you can keep vaccine storage cold instead of not having vaccine storage at all, or using very expensive diesel-based gensets to provide the cooling. All of these provide us with here and now benefits. They lead to understanding what are the key employment benefits, the key energy import reductions, and the key here and now benefits to people who never had access to energy and have access to solar energy now. And most important, this energy is being provided by carbon-free applications.
Let me briefly discuss about ISA's support to LDCs and SIDS to set up demonstration projects. The support is in the form of technical as well as financial, and ISA has been extending a financial support of up to $50,000 under this scheme. And the objective of this is to promote solar applications to meet various energy requirements for health sector, and also the sustainable agriculture in the form of solar pumping,
solar cold storage, etc.
L'Alliance solaire internationale a vu le jour sur initiative du Premier ministre indien Narendra Modi, qui l'a lancé le 11 mars 2018 à New Delhi lors du sommet sur l'Afrique en Inde et une réunion sur la COP 21 Paris 2015.
Le ministère en charge de l'énergie, en partenariat avec l'Alliance solaire internationale, ont signé un accord de subvention pour la réalisation d'un projet de démonstration solaire dans 2 localités.
The facilities. We don't have electricity in the sub-county. Only we have the solar light just inside the buildings. So since the installation of this security light outside, that is a great improvement.
Voilà, là nous avons du matériel. Ici par exemple, nous avons les modules solaires photovoltaïques. Et ici, nous avons les luminaires et la qui sont des luminaires de 50 watts. Là, nous avons l'ensemble des différents DPN pour la protection des équipements en fait. Nous avons donc le coffret pour le câblage donc, des équipements. Ici, nous avons l'ensemble des câbles de liaison, y compris donc le câble pour la mise à la terre. Ici, nous avons des modules solaires pour l'alimentation du lampadaire.
Pour travailler, nous n'avons qu'une seule petite batterie avec laquelle nous nous débrouillons, mais qui n'arrive pas à satisfaire nos besoins. Voilà, une batterie qui est régulièrement en rupture. Voilà, donc côté source d'éclairage, c'est compliqué. Donc, la majeure partie du temps, ce sont des lampes torches qu'on utilise. Voilà. Pourtant, vous voyez que bon, lorsqu'on les utilise la nuit, tout pour les services de dispensaires et surtout pour la maternité, c'est très compliqué.
On est ici pour installer 10 plaques solaires avec batterie de lithium, avec charge de convertisseurs hybrides. Donc, batterie de lithium, je vais vous expliquer un peu. C'est une batterie. Dans la journée, lui, il fait que si c'est chargé, il fait qu'il repose seulement. C'est la nuit qu'il travaille. Voilà. Donc, c'est un convertisseur seulement qui travaille la journée. Donc, on ne doit pas avoir de problème ici. Il y a ça aussi, et puis un panneau solaire, 3 panneaux solaires qu'on a installés. Voilà, puis des ampoules. On a jusqu'à 40 ampoules qu'on a posées aussi. Et puis 3 lampadaires.
Nous sommes très satisfaits, si on peut le dire ainsi. Parce qu'avant, on travaillait dans des conditions un peu difficiles, si on peut le dire. Parce que souvent, sur la nuit, si tu veux prendre une voie même, c'est compliqué. C'est avec nos torches on se débrouillait, puisque les batteries là ne tenaient pas. Et en salle d'accouchement aussi, c'était pareil. Souvent même, tu sors la maison pour rejoindre le CSP la nuit, on vient te réveiller la nuit. Pour traverser, venir, c'est un peu compliqué. Le coin là, il y a des reptiles un peu partout. Voilà. Surtout au moment où il pleuvait beaucoup, il y avait des reptiles. Voilà. Donc, ce projet est vraiment la bienvenue. Maintenant, il faut dire que les conditions de travail seront un peu faciles maintenant. À l'endroit du ministère, c'est de les remercier. Et en plus, on aurait souhaité que la lumière soit un peu partout dans nos concessions également. Là, ça allait être vraiment bien. Si les agents aussi bénéficiaient de la lumière, ça allait nous profiter vraiment beaucoup. Voilà, donc on va faire un plaidoyer pour ça à l'avenir pour les agents de santé aussi.
We have the solar installed. We can on our devices, on our other equipments that needs electricity at the health center to be used by patients like that. Our donor, the International Solar Alliance, and also from the Department of Energy and our Ministry of Health for this successful installation.
Aujourd'hui, l'Asie compte 114 pays adhérents et se propose de mobiliser d'ici à 2030.
As a result, people and governments are a lot more ready to see what are the kinds of policies and regulation tweaks that are needed in order to enable them to grow, to enable them to upscale. And this is ultimately the goal of our demonstration projects. We look forward to making a real life change in the lives of people through solar energy.
Thank you. So, taking it a bit more on what we have done so far, just to give a brief, we have some of the countries in the Latin America, that is in the very remote location in Guyana, where the health center is solarized. 6 to 7 countries in the African region, like Burkina Faso, Uganda, then the Mali, Niger. All these remote locations were some of the hospitals or the primary health centers we could solarize. Over to the Asian region or Pacific region, we have Fiji, the health centers were solarized. So the very fundamental idea which we are proceeding as of now is to, based on this implementation, we'll be having more interaction, we'll having a diagnosis what exactly is the output based on what we have done. And that will give a picture, how do we go ahead on that. And these discussions are very important, because the energy is one part of it, the innovation part which Pradeep was talking about. Maybe I'm also coming from my father, who is a doctor, and many of my relatives, they're all in the profession, in the medical profession. And of course, I was fortunate to be in one of the highly electrified states in India. But when we went to all these remote locations and carrying out a kind of surgery with a torch it's so painful for the people to how the people are having a very tough time. I think solar with battery could be a game changer for all these these kind of remote locations. And one very important factor or important point which DG has brought out, I think we will be focusing on that, is to have a mini grids which integrates all these requirements, whether it is in the health sector, the solar pumping system, and community as a whole. This is one approach we would be having it, and we will have more inputs today's discussion, including Harish, because he has done so much of things in the Northeast, where there are issues in India where these kind of issues are more. Taking lessons from that and the discussions, I'm sure we'll have much more inputs and how do we look at the scaling. And I'll also look at Jagjit, how he will be having more vision to be built in ISA's activities. Thank you very much.
We're going to have a brief conversation with 3 names that have been mentioned and people who have so much expertise. If I may invite Harish Hande, the founder and CEO of Selco, to join me here. Luke Severi from Solar Energy for All, please join me here. And Jagjit, if you could join me here. Okay. I think maybe let me start off by what is emerging from the presentation from Ramesh and the film that we saw. Solar energy makes a difference. It's essential. It improves the quality of healthcare. It improves the ability to deliver quality access to services. Harish, let me put you on the spot. You're probably the man who has solarized more health facilities than anyone else in the world. You've demonstrated that large-scale models are possible. My question is it commercially viable? Is it possible to create commercially viable large-scale health facilities that are solarized?
So, see, thanks, Pradeep, for that question, because the first question is we define what commercial viability means, right? For example, none of the airports in the world are commercially viable. Not a single airport is commercially viable. No roads are commercially viable. Nor energy in the US health centers are commercially viable. So the question for us is, what is a common good Like if internet, for example, is not commercially viable because we're all subsidizing the internet. So it all depends on how do we see what viability means. How do you put a price to a baby who is about to die, right? How do you put a price to that? I think it's a health and education are common goods. If you look like in the US, why is education free till 12th? So that the kids will then pay taxes to the next generation of kids. So health is a fundamental right in many ways, which is through tax monies that we have healthy citizens, leading to tax money coming up for the future. So I think we have to break it up into which part is commercially viable and what is commercially viable, right? So we are presently on a path to do 25,000 health centers by December of 2026. So we are on a target to do 80. We are doing 80 per day right now. And that's why I've lost all my hair. He's joining me soon. The issue is, oh, the minister's come. So the question is, it's extremely viable for the state. Pradeep, if you look at from a just purely financial, if I look at a financial break-even lock, it's 7.5 years to 8 years break-even. And even if I look at the loss of equipments because of voltage fluctuations, we have seen that in the 5,000 that we have done, 20% of the health facilities have lost equipments because of voltage fluctuation. That cost is hugely expensive for state to replace. The savings that the state does in terms of not having to replace the equipment itself is viable from a yearly perspective. So I would go back and say, how do you redefine commercial viability from a health and education perspective? And then say, these are the parts that are viable from a the taxation purpose, another. Because the same challenge I would put on the education system. Right? And the first thing when people ask, we were asking, that said, if we make JFK Airport viable, we can make health centers viable. And JFK Airport has not been viable in the last 40 years.
Well, thank you very much. I think maybe we have somebody who says it can be done. So I'm going to put you on the spot in a minute, but I just wanted to recognize the presence of the Honorable Minister of Energy, Water Resources and Irrigation, Minister Shakti Bahadur Basnet. Thank you very much for being here, sir. We'd like to hear from you in a moment, sir. We would love to, maybe I can put the others on the spot and then come to you to see where you see the opportunity, because you've done so much in Nepal and bringing in the energy transition for healthcare. So I would love to come to you in a moment. But as we, Harish, thank you for that. And one of the real opportunities I see is that one is the commercial viability. The second part is the ability to convince policymakers to invest. And you have all the right arguments there, what you shared. The cost of the long-term benefits
Absolutely.
are significant. But what are the challenges that you face when you're looking at scaling these models in different countries? Is it technical? Is it political? Is it investment? What is it? Why is the world not gone? I mean, for me, what I still don't understand is 1 out of 2 people don't have access to healthcare. And there's no way you can change that without having energy security.
Agreed.
So why is it that people are not doing that?
There are 2 things. Thanks, Pradeep, for doing this. I think we as a sector need to take responsibility as the energy sector. We have totally concentrated on the capex and not on the opex till date, right? Typical example with Meghalaya, which is the one good part of the bookend, where Meghalaya government has created as an O&M in its own office, in its untied funds, created a line for solar after-sale service, and its hotline, number 4, is any issues with solar in health facilities. So it has gone beyond to create that, and that's why. On the other hand, when I met the Minister of Uganda, he said, Harish, 8 or 9,000 systems of ours have solar, 8,000 are not working, right? Now, and then he said, this is USAID, that is GIZ, that's UNDP, that is this, that is that government, right? So we've also not designed programs where CapEx and OpEx are thought from day one. What is the 10-year outflow? Who pays for the batteries in after 5 years? Who maintains? We all talk about training the technician, but if the technician goes to the hospital to repair it, who pays for him, right? Training becomes the end goal, but not the financial linkage to who the technician is. So I think but these are all solvable problems. The good part is this is solvable with lots of models, whether it's a decentralized model, whether it's a pay-as-you-go, what they are trying to do, what SA for All is doing in Sierra Leone. All these models need to be perked. He might be doing a model that is Word. I am doing that is in Excel. He's doing a PowerPoint. What do we use for? All these models should be put up in a database. Depending on the criteria, it's rural Ethiopia, I will take a combination of his and our model. If it is in Sierra Leone, I'll take a combination of this. We as a sector have not been able to collaborate and say what are the plus and minuses. Once that is done, I don't think so between 2027 and 2030, we should be looking at the whole world. And it does not require, Sierra Leone, 6 million people, highest maternal deaths, only requires $18 million to $20 million to reduce it by 50%. So money is 18 million only. So I think somewhere we need to look at it more seriously.
There's a complete disconnect somewhere. And for those of you who want to look at the model of what a health facility looks with and without electricity, particularly for maternal and child health, you should visit the Selcos. You have a center here where people can visit.
We have a 3D experiential center. How a child gets delivered without solar and with solar. You'll feel it. It's a 3D real time. It's in B2 near the IRENA office. It's outside. You'll enjoy that 6-minute visual of how it actually works. So
it is also to get into the shoes of people who are there. So I would highly encourage everybody to be there. Before coming to the money part, let me look. I know that you have a report coming out. I won't ask you for insider previews of that, but you also, one of the challenges that many people speak about is the whole issue of, one is the models which Harish also spoke about. Number two is the whole issue of cost of storage. You're doing some really creative work around these two. Where do you see this going? What do you see as that tipping point?
I think if I need to be honest, I think the cost tipping point is well behind us. Cost should not be the excuse anymore. 10 years ago, sure. 10 years ago, if you had $1 million project, solar was very expensive. That's why we had all these small solutions out there, just enough to power the vaccine. Today, no. There's no more excuse to say all we can do is this one thing, like one light bulb, etc. No. Big solutions, not just a health facility, staff quarters as well. Think about growth, right? If we want to say, how do we keep these systems going for the next 10 years, think about what additional health services are also needed in 10 years. Because that is, for me, it's not necessarily the cost, it's not the technology on the supply side, it's actually the demand side that has been lagging a lot. And again, this is where these guys are doing a ton of great work, but it needs to be scaled, needs to be replicated. The demand side factor, the appliance side, how do we get energy efficient, fit for purpose medical appliances in rural Uganda, in rural Tanzania, in India? Because that is what we currently don't have. You go to a facility and you'll find amazing equipment that they cannot use because it's donated from Germany, it's donated from other countries. I don't want to put any country on the spot. Every country donates materials. That is one of the biggest barriers that I see in terms of, we could put solar panels on a clinic tomorrow. That's the easiest part of the entire value chain. Keeping them running and making sure that they're used is much harder. But I'm with this guy. By 2030, we have no excuse. We have to do it. The gap is not that big. It's big, but it's not that big.
Those of you from the energy world understand this. Does the health sector also understand this? People from the health side. Is it that we are speaking in two different languages and people are not coming together? Is that the challenge, or is it just that things have evolved and we have not understood that?
5 years ago, me would have said yes. We just came out of a global pandemic. The energy thematic building is next to the health thematic building. By chance, maybe, but if we shout loud enough, they'll hear us, and vice versa. In the past, yes, it was energy people that were just sitting on the stage. I was on many of these stages with Harish as well. Today, that's no longer the case. We see massive momentum in WHO, Gavi, UNICEF, Clinton Health Access, like you name it, Save the Children, Care, like all the international NGOs are, whether they're approaching it from a health perspective or a climate resilient health systems, power is and is such a critical point of that. It's not sufficient, but it's absolutely essential. So I'd say, again, no, energy and health sector stakeholders are there. That is no longer the barrier. Sure, we speak a different language, and sometimes we need translators to, the electrician and the doctor, they speak a completely different language. And so you need somebody to be the translator and the table and the chairs. That's the role we play from time to time. But I am very optimistic in terms of where we're headed, who is at the table. I think very few people are missing. Just because we're here at COP, if there's someone missing, climate donors. Let's get them at the table as well.
It's an interesting point. 2% of the climate funding goes to healthcare. So we need to see how that also gets balanced. But that shouldn't end up being the health people wanting to, it shouldn't be territorial. We need to make sure that it goes where it makes sense. Talking about finance and looking at the financing landscape, looking at where the world is going, where do you see, Jagjit, from where you're sitting? You've been with the World Bank, you've been with ISA, you're now with Dalberg. Where do you see this going? Do you see resources coming up? What is your prescription for the world?
Thank you, Pradeep. And every time I hear Harish, I get really, really inspired. And thank you for doing this commendable job. We need to do more, of course. Speaking at ISA Pavilion is like homecoming for me. I spent my 4 years. We started ISA Cares during COVID, solarization of healthcare centers. With our own operating budget, the first Director General, Shri Upendra Tripathi, pushed us to do whatever we could during the COVID times. So we started with small initiatives. How to take it forward? So let me first, complicate your problem a little bit more. Solarization of healthcare centers, solving the energy problem is one, but climate is going to create havoc for the whole healthcare systems, for the diseases, whether these are communicable diseases, infectious diseases, non-communicable, or just stress on the healthcare system, or on the food, or on water. COVID was just a premiere of the movie which is going to come, scary movie. So in terms of why, it's very clear why we should do it. But if you look at the numbers there on why, health and climate intersection. So my colleague Oren, I don't know if he's in the audience there. Hi, Oren. He did a study for a landscape of climate and health funding for the last 10 years. So we saw that, from $500 million, the numbers went up to about $2 billion for the research grant. But if you look at how much of that money was spent on this research in South Asia, 1%, Africa, less than 1%. This region, less than 1%. So in terms of understanding of why, at a granular level, when the heat will go up, what that stress would lead to various diseases, vector-borne and others, our understanding is still evolving. We need to spend a lot more research amount there to get a handle on it very, very quickly. So now if we have figured out why, we need to say what. And what means, okay, we know this is how it's going to cause the impact on various diseases. What do you do? I think there, the fund which HIX, along with various partners, are thinking of launching, the innovation part is the key there. The second interesting element there, which is central to why we are supporting HIX on this as Dalberg, is the equity part. We need to create solutions which are affordable and can grow to scale. We see many solutions which are affordable, but they never go to scale because of various financial economic reasons. What they're trying to do is seed innovations and then create ecosystem which then go to scale. So we are getting a bit of a handle on what to do. Then you come to how. And that's where we are supporting HIX and partners in designing a blended finance structure. The recipe is old. We know how blended finance works. You get some grant money, some risk capital, blend with DFI money, blend with private money, different risk appetite, different return expectations. Grant providers take a bit of the risk. Rest get lower return than what they could get from market. But overall, we are addressing a market failure. You get volumes and you deploy. Easier said than done. ISA is trying to build a solar risk facility for Africa. It has taken 3 years. They've secured 35 mil, where the demand is really clear. The how and the what, everything is clear, but it takes longer time. While we hear all these trillions, hundreds of billions, and God knows how many hundreds of billions would be announced here, putting them in a structure, deploying them in a projects is a journey. So the nimble the structures are and ready the pipeline is, the better it is. So what our recommendation to colleagues here is, let's equally focus on the pipeline of projects which generate you ideas, solutions, which are affordable to people on the bottom of the pyramid, in Africa and Southeast Asia, who are going to be the worst hit from the heat, from the flood, you name it, all the impacts, which can then go to scale. So the way this fund is again structured would be heavy on the ground, both at the project side, but also creating the ecosystem, the enabling environment. Again, we know how these things are done. But question goes, why JFK is running and healthcare centers are still struggling. I agree with you. But I think collectively we will make an attempt to get this facility up and running. It would be launched, I guess, in May. The hope is that within a year we should get it capitalized. Our fund size is about $500 million. But we would want to begin with $100 million of commitment and ramp it up. So it's our commitment as an institution, Dalberg, to work with HIX and partners to see it through. Happy to answer questions.
Jagjit, thank you very much. I think the good news, we have 25 million in commitment already in grant funding. So we are very, very pleased to announce that today. I know that we are running out of time. The only one quick quip about JFK, why it is running and why health facilities. One is not subsidized, but it's the rich people who are flying. It's not the poor people who are flying. The moment it was poor people who was flying, JFK would collapse. And that is probably the challenge with healthcare in the bottom of the pyramid. Thank you very much for being here. It is my honor now to invite, thank you, Minister Shakti Bahadur Basnet, the Minister of Energy, Water and Irrigation. Sir, thank you very much for joining us. I would really love to. You're one of the enlightened ministers who has seen the importance as an energy minister to work across sector, whether it is agriculture, health. We would love to hear a little bit more. How can we speak to your colleagues who are the ministers of energy to invest on health? So over to you, sir.
Thank you. Thank you, Mr. Chair. Distinguished delegates, good afternoon and namaste. On behalf of the government of Nepal, I would like to express my gratitude to the organizers for hosting these emerging financing models at the intersection of climate, health and equity, building climate resilient and equitable health innovation ecosystems. I'm pleased to speak in this session. Thank you, sir. Ladies and gentlemen, needless to say, climate change is among the greatest crises for the globe and humanity. It has impacted all aspects of life, including economy, health, and livelihood. The impacts of climate change has widened the gap between the prosperous and marginalized strata of the society. As an impact of the prosperous and impact of climate change, various new diseases and public health issues are emerging, disproportionately impacting the women, children, and marginalized groups. In this context, discussion on various financing models for health infrastructures in the prime importance. As we stand on the threshold of unprecedented challenges at the intersection of climate change, public health, and social equity, I firmly believe that collaborative international efforts are indispensable. The insights and discussions that unfold during this session will undoubtedly contribute to shaping innovative financing models that trans borders and have a lasting impact. Understanding the intricate links between climate resilience, public health, and social equity, we must foster collaboration and share best practices. It is through collective action that we can build robust health innovation ecosystems capable of effectively addressing the multi-affected challenges presented by a changing climate. Introduction of new financing models for quality health service at all levels requires suitable policy and regulatory instrument, business models, technology, financing and capacities at national and subnational levels. Countries have high-level committees, councils, and emergency response authorities. Time has come to refresh their roles and responsibilities. We also need to develop emergency or disaster-sensitive public health system and financing models that will help in leveraging the resources required for fast response for equitable health services and innovative ecosystems. Our global institutions are trying their best to be efficient in leveraging their financial resources. However, we haven't witnessed faster responses from them. Let's work together to make our global institutions efficient. We need to improve our health policies so that their interconnection with climate change impacts is well understood and prioritized in national planning and programming. We also need to develop a mechanism to feed the resource findings and community actions into the financing models, hence developed and implemented. Development and expansion of energy infrastructure is one of the key components of building climate resilient and equitable health innovation ecosystems. Having reliable and quality energy supply is a prerequisite for equitable and sustainable health services. Nepal has prioritized clean energy transition in all sectors. Second, nationally determined contributions, long-term strategy for net zero emissions by 2045, NDC implementation plan, and energy sector roadmap and action plan, which we are planning to generate 28,000 megawatt hydropower by 2035, has highly prioritized to development of renewables as well as upgrading and expansion of transmission and distribution infrastructures. Learning, sharing, and partnership among all of us would be instrumental in fulfilling these requirements and hence achieving the climate resilient and equitable health services. Let's collaborate to develop sustainable, resilient, and equitable health services. Thank you so much, all panelists. We stated valuable statement for us. Thank you for organizer to invite me. Once again, thank you, all of you. Thank you so much.
Thank you, Excellency. You cannot have this transition happen without partnership. So Kai Vanderhorst, who is a senior advisor and one of the global experts on health, and he's going to walk us through the panel. Over to you, Kai.
It is wonderful to be here. In the interest of time, I would like to ask our panel to kind of join us here. And then we'll do introductions very quickly, and we will try to stay within the realm of time. While they're getting some thoughts, so we've heard a lot about climate mitigation. We've heard about solarization. We've heard about energy efficient healthcare systems and ways to really create mitigation strategies in all different types of settings. What we've heard very little about is adaptation. And we have some of the world experts sitting here at the table today, and from very different perspectives, which makes it very exciting for me. So we have experts from ADB here, we have NGOs here, we have philanthropy there, and we have people who leaders in innovation and driving innovation pipelines. We've heard this earlier. So I'm going to stop talking, and I will give the first word to Patrick Oseve, who is the director of the Climate and Health Initiative of the Asian Development Bank. And Patrick, I want to just hear from you. What are the things you've been learning over the past months that you've been implementing this initiative? What are the challenges? And also from the perspective of what does a fund like Chief, how can it contribute to your already existing mission, to your already existing portfolio, and accelerate what you're aiming to do as part of ADB?
Hello, can you hear me?
Can you switch his mic?
Hello, can you hear me?
Yeah, we can hear you.
So I'm the head of the for health for.
No. Can you fix? Yeah, come here.
Hey, Patrick. Yeah. So I'll just take it from here. So I'm the head of the Asian Development Bank Health Program, and we are very much involved in supporting climate. We call ourselves the Climate Bank, and our president committed in 2020 that over the 10 years we'll spend $100 billion on climate, but it was overall statement. And so we as a health team decided that we wanted to look at how do we support our countries to benefit from these resources that were made available. And so internally we started looking at what is it that we should do. We reached out to the government of India, and because they were the presidents of G20 this year, we started a whole conversation to bring together the G20 countries to endorse climate and health. So we started with participating at various working groups, doing significant analytical work to inform the membership and the world about the impact of health and climate. A lot of work had been done by WHO and others, more or less more at the advocacy level. But here we are focusing on implementation, because as a development bank, we give money. And if we give money, we buy services, we buy goods, and we must get value for the money that we are spending. And so through the 1 year working with the G20, the ministers of health endorsed climate and health, and also the Leaders Summit. And we established within ADB and with the Government of India's support, the Climate and Health Initiative that was launched today by our president at a previous meeting, basically catalyzing 6 things. One is looking at issues about knowledge. We're talking about climate and health, and the reality is that the bulk of the people within governments have not even thought about this as a health issue. So knowledge is extremely important. The second is innovation and working with private sector entities to come up with, when you talk about climate and change, you talk about mitigation and adaptation, what exactly are the inputs that are required, what are the results that are required, and what are some of the things that we should fund. So there's still a lot that we don't know. We know enough, but we don't know a lot, and therefore it requires very strong partnership to collaborate with others and so on. Third is the issue of the best buys. What are the best buys? If you want to spend money and you have 100 million or 200 million, what exactly can we buy? What should partners buy? And this is a big area that we're collaborating with the World Bank and other MDBs to define what are some of the best buys. Technical assistance is lacking. We supporting many countries, and they're asking us that we would like an expert on adaptation, an expert on smart buildings, an expert on smart supply chain. We are struggling to get them. They really don't exist. And therefore, we together as MDBs, we've come together to work and establish a database to be able to have this critical mass to support countries. One challenge, we have highlighted climate and health as an important aspect, created demand, we lack supply. There are only 2 universities, mark my words, 2 universities in this world that are producing, that have a master's in climate and health. Only 2 universities. So who is actually going to do this work at the country level? Who's going to drive this initiative, the planning? Serious challenges. And lastly is the financing. Significant financing is required. That's why we're talking to Chief. We are brainstorming, and how can grants or how can strategic investment be made at the country level to mobilize our lending, to be able to have more resources. The Pandemic Fund, for example, in India, just recently, they provided $25 million for One Health, and we provided $175 million. Sometimes little grants mean a lot to countries, and therefore they then can borrow for those specific areas, because there's a financial limit to what a country can borrow. But if they see a grant, then they actually prioritize that borrowing. So we look forward to working with Chief and look at opportunities to strategically work together to be able to catalyze more work and more lending and more financing in this area. Thank you.
Thank you very much for that, Patrick. And we are excited and very much looking forward to working with you. We met with his DG yesterday and had a very exciting discussion. So that synergy is really welcome, and we look forward to that. Now I want to actually really I'm actually very much looking forward to inviting Carly Silver, who is the CEO of Grand Challenges Canada. Decades of experience, her organization as the new CEO now, but also years in being involved with Grand Challenges, building technology innovation pipelines in different types of ecosystems. And one of the big challenges is how do you translate them, how do you scale them, and how do you actually build out that innovation ecosystem. So here's the experience, and they are just about to release a major catalog. Over to you.
Thank you very much. It's good to be here. I think the microphone's working now. Yeah? Okay, cool. So as Kay was saying, we focus on solutions, and one of the things we focus most on is solutions that come from those who are closest to the problems that are supposed to be solved by those solutions. So a long-winded way of saying local innovation. I think this is really important in the context of climate change and the health impacts because climate change looks different in different places, and how we address it needs to be examining that nuance. We also fund locally because we think it's most likely to have impact and to be sustainable. And so it really comes from a place of not just kind of a moral right, but also a pragmatic, like, this is how we're going to get the best innovations and the best impact. We have funded in global health for about 14 years now, and we're realizing that climate change was starting to mess up the impacts of the portfolios. So this, again, is coming from a pragmatic place of wanting to understand what can we be doing better in thinking about the health impacts of climate change. To do this, we launched a call for proposals to actually landscape the innovation landscape. We launched for innovations that address the health impacts of climate change. We got 800 applications and across 80 different countries. 3/4 of these were from innovators in Africa. And so it gives you a bit of an idea about the kind of areas these were coming from. And as Kay said, we've just launched a report today that that share some of the insights we learned from this landscaping. And you can go to our website at grandchallenges.ca in order to find that. A few things we learned: innovators in different parts of the world are focused on solutions for different climate-related health issues. So for example, in Bangladesh, we saw that innovators are mostly focused on extreme weather events, flooding, and water-related risks. In Cameroon, it was mostly food insecurity and disease threats. In Ghana, it was health system strengthening. In Kenya, it was agriculture. So this idea that it looks different in different places is really coming out in what people were prioritizing to put solutions forward for. Second little tidbit I'll leave you with is that 25% of these applications were from for-profit entities. They mainly focused on the impacts of respiratory illnesses and non-communicable diseases. So it gives you a bit of a hint as to where the kind of commercial market is in this, but there's huge gaps, obviously, if you look at where the biggest drivers of health impacts for climate change and how there's some serious market building that still needs to be happening in this area. We always look at the innovations as as a whole pathway from these early ideas right to where they need to be pulled to scale. There's only so much we can do to push them to scale. The supply of innovations can only go so far by funders like ourselves. That's why we work closely with those who can actually pull the innovations to scale. Chief would be one of these. We work with other impact funds in order to look at both financial returns and impact returns. And I think a special thing to recognize that I know is being fed into a lot of these funds now in the design is understanding where governments are feeding into that demand pull. It's great to see that panel just now pulling up the voice of governments, but this is a critical element to be able to actually see where we're going to have the sustainable backing so that those things that aren't actually sustainable can last into the long term. So I'll leave it there, but happy to expand more.
This is wonderful. Is the mic still on? Okay. So I think that point that you just made about stakeholder engagement is, I think, really near and dear to our heart. And we talked about it with Patrick. I haven't talked to David about it, but I've talked to your colleagues, right, and the team and Josh. But getting not just to the government level, but really getting to the community level where the adoption needs to happen. So innovation is fit for purpose. It is scalable. It is sustainable. That's where we want to look as Chief, and that's where adaptation technologies really become a big deal. Thank you for that. And your pipeline is really going to be great for us. So onwards.
We actually have, I'll just say really quickly, we've also just announced just over 40 new innovations. Those are also on our website right now in the climate and health space. So you can start to see kind of what the solutions are getting to the pipeline.
Awesome. Benjamin, you're next. Philanthropy and the role in climate change and health. Give us a perspective of what you see in the ecosystem right now and how it's evolving.
Thank you. Yes, thanks so much. So I'm Benjamin. I represent a global network called WINGS, which brings together 220 philanthropic networks and foundations around the world. And we're trying to build the ecosystem and to build the sector with particular attention to emerging markets and the global south. So our perspective on these issues is not thematic, it's not technical, it's really about the role of philanthropy, including the role of philanthropy as a partner with other actors to accelerate change, including on climate. And so for us, actually, this intersection here, climate with health, is probably the best entry point to engage philanthropy in action, because actually we have a few big names when we think, okay, climate donors, philanthropy. So now is the Bezos Earth Fund and SIF, and there are a few massive foundations that invest in climate. But they're a really very, 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 very tiny fraction and portion of philanthropic investments. It's less than 2% of philanthropy capital goes to climate issues. However, if you take health or if you take education, these are the top focuses and priorities of foundations around the world of different sizes. And so the work we're trying to do at WINGS on climate actually, is to bring these funders that do not think about climate as their business or their role or their focus, to bring them to work on climate. So that intersection is extremely relevant, I think, to bring on board the philanthropic sector, especially the sort of average, mid-size foundations around the world. And so at WINGS, we have started an international commitment to bring foundations on board on climate called Philanthropy for Climate. So it's a movement. We have 670 foundations now that have signed the commitment. And it's really about integrating transversally climate into their work. And so now one of the next steps for us is to help them with the translation of what it means for them if they're a health funder, for example, to think about climate, to integrate it. And so we're very interested in some of these examples that will come out of your work, and so being able to give technical guidance for foundations who work on health to be able to integrate that energy dimension, that climate dimension. And this is across the board. Like, this is also for, again, economic development. It's for relevant to other issues. So that's one thing. Another thing I wanted to highlight is that at WINGS we're also very actively trying to build the local infrastructure, the local ecosystem for philanthropy to grow, for more resources to become available and also to become more effective, and also to be more collaborative and to partner. And we, just like I think a great parallel between what was explained around building the innovation ecosystem, around solar energy and etc. That we're trying exactly the same thing on building the ecosystem and the enabling environment for more and better philanthropy, including in the Global South. And one of the key aspects of that is we need to create collaboration mechanism, coordination mechanisms on the ground so that development banks, philanthropy, government, business can come together and identify these solutions, these opportunities to partner, sometimes with blended mechanisms, sometimes simply sharing learning, sharing expertise, because foundations have little money if you compare, of course, to other sectors, but it has, proximity to communities, it has expertise. So we need these spaces and these collaboration mechanisms so we can leverage that potential for philanthropy to contribute to this agenda. So we're also happy to explore ways to partner on how we can build this infrastructure for partnerships on the ground around these issues, and we have some ideas and projects. And so just as a conclusion, I just wanted to make a little bit of a parallel, and the reason why at Wings we decided to work on climate is that we consider it has become a sectoral issue for philanthropy. It's across everything that we do, and it impacts everything that we do. And I think this particular intersection of climate and health is really very relevant and symbolically important, because if I do a little bit of philosophy, I just feel like if we think about the climate issue, the climate crisis, we can't have a healthy planet if we don't have healthy lives, and we can't have healthy lives if we don't have a healthy planet. So it's both upstream and downstream that we need to think about that. And so I just would like to encourage us all to think about how we can work on projects that help address these issues together, upstream and downstream. Thank you.
Much appreciated, Benjamin. I would love to kind of follow up on this, but we're tight on time, and I look forward to diving more deeply into the next, when we get together tomorrow. Josh Carliner, Healthcare Without Harm, a totally different perspective. You've been in this field for a long time. What are your learnings in terms of where we see opportunities, obstacles, and kind of where we should be moving and focusing on?
So the opportunities are everywhere all of a sudden, and they weren't for a very long time. We've been working on climate and health for the past 15 years.
Yes.
We are an international NGO. We have offices in the United States, in Brussels for the European Union, in Manila for Southeast Asia, and partner organizations in South Africa, Brazil, China, India, Nepal, and Australia. And we have a global network of hospitals and health systems that is now in 84 countries, 1,900 institutional members representing the interests of about 70,000 hospitals and health centers. So what that allows us to do is we work in collaboration with a number of different international organizations like ADB, like CHI, the WHO, UNDP, and others. So we're able to work from both the top down and the bottom up, and we sort of have a perspective looking both ways. But as this movement has grown, as this movement has grown and really virtually exploded in the last couple of years, where there are so many health players getting engaged on the climate issue, we're seeing our role more and more as sort of a facilitator and a guide to help move this forward. We have a tremendous number of examples on the ground of hospitals and health systems and health centers working toward greater sustainability and resilience that gives us technical expertise. And we also are able to collaborate with different organizations. So 2 quick examples. One is the COP26 Health Program, which in my view really opened this whole thing up in Glasgow when 53 governments committed to climate resilience and climate mitigation and low carbon health systems, which now is the Alliance for Transformative Action on Climate and Health. And they will announce today that it's 83 national health ministries that are on board. That was a collaboration between WHO, the UK COP presidency, and us. And so we were able to bring the expertise that we've developed and help guide and develop and frame and shape that program. And that's opened up the space for a tremendous amount of opportunity for finance on climate and health. Similarly, we worked closely with the ADB to help ADB shape the G20 program and bring our experience and expertise and basically share that with ADB in a way that they were able to work with the G20 presidency to establish what is now the Climate and Health Initiative and achieve the leaders' declaration on wording on climate and health, which is parallel with attach. So we've been helping to align things, shape things. We're working with Chai to try to figure out how to address the supply chain issue, where Chai has a tremendous amount of experience. And so we're seeing our role more and more as a connector. And what I'll leave you with is in terms of the thoughts about climate finance and health, or financing climate and health, better said. There's probably 5 key buckets here. One is what everybody's talking about, which is how do you leverage climate finance for health? How do you leverage the Green Climate Fund and other financial mechanisms? The second bucket, which is potentially in some ways more important, is there are, depending on what estimate you look at it, there's between $40 and $50 billion a year. That's not just committed finance, but real finance that goes to health around the world. And so what ADB is looking at right now, and what other multilaterals are looking at and bilaterals are looking at as well, is how do we take that health finance and not take it away from health, but how do we make it climate smart? And so that's a key thing, is how do we leverage existing resources to move away from perhaps a less sustainable model and a less resilient model to something that is green, climate resilient, low carbon. The third bucket is national health budgets themselves, which is where a lot of the money is at, right? And those budgets need to be transformed in a similar way. And then the fourth area is philanthropy, which is super important, right? There's a lot of health philanthropy, as you mentioned, that can go to climate in a very smart way and in a way that helps protect health from climate change, helps mitigate and address the root causes of the problem, and it supports adaptation. And there was a fifth, but I'm not remembering what it is, and we're running out of time, so I will leave it right there. But just imagine there's a fifth bucket, and you can figure out what it is.
Maybe.
Sorry? Innovation. Oh, okay, yeah. I mean, innovation across all of those. I would say that's cross-cutting. But
awesome. David, Clinton Access Health Foundation, so initiative. Can you give us a structural view, kind of lift this up a little bit? Don't go into detail, but what are the challenges you see with governments, intersectoral alignments, and so on and so forth? What are you, especially since you work in 30 countries plus?
Absolutely. Chai focuses on supporting low and middle income countries, and we're present in 35 countries across all the major continents. I think when we summarize a lot of these challenges, in the United States we call it the chicken and egg problem, which comes first. We need solutions that work, that will solve a problem, which we can access, and we need the financing to pay for those solutions. But if I don't have the financing, I'm not going to see the innovation and private sector interest in the solutions, and so nothing happens. Fundamentally, we as an organization try to solve those problems, and we believe the key is a third area, and that is the leadership of national governments. If you go to a government and you tell them, I will fix the financing and I will fix the access, write a plan that will address the issues in your country, you will have high quality, fundable plans to address the real pressing issues of the day nationally. With those credible plans, the case to financiers, donors, lenders, and others is more clear. I see a path to spending my money efficiently and effectively to have big impact. For the innovators, now there's an incentive. I see money, I see a market, and I am going to innovate and create those products. So for us, really the key is empowering government leadership and government ownership, and it's really been refreshing to hear the perspectives of this panel, because many donors do not truly live the principle of listening to governments and funding what they demand. And so maybe I can spend a moment on governments because that's where we spend a lot of work. And we know even within governments, there are different groups. Minister of Finance holds the money. They're up here. I'm not sure where energy sits. It's probably not at the finance level, but a bit lower. Health is down here. In the hierarchy of ministries, ministries of health are not at the table. They need the TA support to write the plans, to be at the table for those national discussions on climate change. You know, in the solar discussion, I was fascinated in that I've had discussions from a health perspective with solar donors, and they tell me, the health space is tiny. I don't want to see a health-based plan. Show me a national plan that includes health, and I'll fund that. If we listen to ministers of health, they will tell you, and you say, what do you need funded? Number one, they know exactly what their climate and health issues are. Number two, they know that they have funding to do 80% of what they want to do from global health donors like Global Fund, like Gavi, and others. What they need are donors to break the silos and break those vertical focus and allow them to go from an 80% solution to a 100% solution. And so I'm really excited to hear about this new fund. I hope that is really ultimately what this fund and the various stakeholders on the stage are aiming to do. Maybe I'll stop there.
My goodness, wonderful. You know, I can't really express my appreciation enough of all these diversified views. And, you know, you told a story together. And just listening to that, from innovation to philanthropy to NGOs, from a vision of a development bank, and then a philanthropy that's implementation in a structural way. We are very excited to work with you as partners. We are very much looking forward to it. Let's make an impact together. Thank you very much for your time. I'm going to hand it over back to Pradeep so we can close out the session and some final remarks.
Thank you very much. I don't think I need to do much in terms of closing remarks other than to say it's been a fascinating conversation. What we are seeing in the whole space is that, one, from a leadership perspective, the leadership is there. We heard from the minister from Nepal, we heard from others, that it is possible for us to provide that the understanding is there, the recognition is there, the technology and solutions that is there, the financing, it is there. It might be spread out, it might be disparate, but it is there. I think from the chief, the Climate Health Innovation and Equity Fund, from our side, what we are doing is to create an acceleration fund that will help to bring all these pieces together, to work together, to have impact. So I just want to thank everybody for being here. We have some thank you gifts from our wonderful host, Aisa. So over to you, Rameshi. To the minister. Patrick, if I can call you. We have a gift for you. Please join us. Please come. We have a gift for you. Well, this is not just a gift, it's a commitment. You have to pay for it one way or the other. While we're doing this, I also want to recognize a few people who have been absolutely central to bringing all this together. Riju, who is the Chief Technology Officer for Health Innovation Exchange. Paula, who is sitting there,